Hi, this is Healing Talks with Kingdom Docs.
Hi, I'm Dr. Hussein Musa,
I'm Dr. Adatone Musa.
and I am my wife's favorite husband.
That's true. That's true. Ha ha, funny.
That wasn't a real laugh. It was a good joke.
You know what? You're right. I should expand my repertoire of jokes, right? Is that a dad joke?
That's a mom joke.
Okay, so we're going to continue our discussion about access to healthcare and this different model called direct specialty care or direct primary care.
Yes. So we talked about some of the problems with our current healthcare system, which is access to care.
Mm-hmm.
The time you get to spend with your doctor often is not enough to elicit a very robust history. And also the insurance can limit what type of care you can receive.
Mm-hmm.
So this model of direct care is a way for you to work directly with your doctor.
Mm-hmm.
And why is this important on Healing Talks with the Kingdom Docs? Well, we believe that having time with your doctor and access to your doctor will improve your overall health.
So directly interfacing with the doctor and cutting out the middlemen, which would be, employees that have to call insurance companies and verify medications, all these things, that increases the quality of care.
Yes.
Yeah.
And our current healthcare system, it requires doctors to see a lot of patients to get reimbursed enough to pay their employees, to pay their overhead, and to keep the lights on.
Mm-hmm.
So one of the beautiful things about a direct care practice is that there's a lower patient panel. So a traditional doctor may have upwards of 2,000 patients that they're working with, and that's how they're able to maintain their business. Now, what are some of the problems if you're following that many patients?
There are a lot of problems because of the pressure to see so many patients because you're paying so many people. One would be, for instance, I've had a lot of complaints about not being able to reach their doctor for patients. They have a medication question, they have a diagnosis question. They're calling and calling, but the doctor just doesn't have time to call back right away.
Yes.
Because he's dealing with 2,000 patients.
Yeah, so let's say if you have a patient panel, let's be generous, of 1,000 patients,
Mm-hmm.
and you get 10 messages a day on top of your schedule of seeing 20 patients a day, and you call back one patient and it leads to another question, you could easily spend 10 minutes on the phone with one patient and you've only answered one message, but now you're 10 minutes behind schedule to see your 20 patients, and if something else comes up, at best, you'll finish the day an hour behind and you still have about 9 messages left to address.
And this is a typical day for a physician. And, like we had discussed before, a lot of doctors are okay sacrificing their time, their personal and family time, even time to just focus on their own self-care to get all of these patient issues addressed because we took an oath, first do no harm.
Yes, and this practice of medicine, it is a calling, and so many doctors, especially in your training, this is part of your life. As a trainee, you actually do a lot more work as a resident. Remember when they limited resident work hours to about 80 hours per week?
Yeah.
That was a big deal.
Yeah, it was a huge deal. And as far as all of these physician access issues, I can give an example. One patient had a lot of questions about his medication for seizures, ended up stopping his medications incorrectly, and then went into what we call status epilepticus, which are seizures that do not stop. This would have been prevented with adequate counseling and more patient time.
Wow. Well, that's all for this time. We look forward to speaking with you next time on Healing Talks with the Kingdom Docs.
Bye-bye.